And then Lindsay saw somebody in Teams, so I'll let you message that. Mandy, you survived. So before we live stream, or we are live streaming, but I got to tell you, we're gonna give a little. Mandy had her first beer ox yesterday, and I am from a very German community, heritage, and so just had I know what that feels like when I came to college here at Fort Hays and had my first beer ox, and and then I introduced her to, have you heard about Runza in Nebraska? And so she loved it though, right, Mandy? I'm not gonna put words in your mouth. I hope you enjoyed your first beer ox.
No, it was delicious. I kind of, just thought about it for the rest of the day. It was absolutely fantastic.
I had to chuckle because I'm like, I had to leave Hayes for the day to go have a beer ox in Wichita. So it was all worth the wind, all worth the wind. So we have several panel members who will be trickling in this morning, some out with illness. So it is that season. People are having Christmas breakfasts, they're having going to children's celebrations, and some have ill children or some are ill themselves. So it's, again, just reflective of, I think, the time of year. So we're going to let Lindsay pull up. Okay, welcome to the early childhood Oh,
I'm just going to start the recording, Melissa. I'm sorry to interrupt you.
no, please. Okay, welcome to the Early Childhoods Recommendation Panel. I am Melissa Schomburger, and I serve as the panel's chair, and just glad to have everybody here today, and hopefully nobody blew away. Just a reminder that today is a remote meeting, and ask that when panel members come off mute, that they introduce themselves and clearly state their first and last name for anybody who is joining as live stream or watching this later on as we are recording this, and this will be posted on the Children's Cabinet's website. Just a reminder that as we are following the remote meeting policy, that all questions we ask be verbally shared, and very sparingly use chat if there's like an issue with your stability of your connection. Please let us know. But again, we really want everybody to come off mute and use the interaction function of today's meeting. And always like to remind everybody of why we are even meeting today as a recommendations panel. The Early Childhood Recommendations Panel serves an advisory to the Children's Cabinet, who is directed through an executive order to provide key information to legislative stakeholders, state representatives, and the governor's office. And we have an ecosystem update. If wanted to give a hearty congratulations to the newest appointed, the inaugural, right? It's not even the newest, it's the inaugural appointed deputy or executive director of the Office of Early Childhood, one of our very own panel members, Christy Smith. So if you have not seen the governor's announcement that came yesterday, I saw on social media and appreciated as an employee, a state employee, Christy's very warm welcome and address that she prepared. And totally put this out there. Christy did not know we were going to do an ecosystem update. So Christy, I'm sort of putting you on the spot, but wanted to see if you had a few words you wanted to share with the panel.
Sorry, I have to find all the buttons to come off mute. Yes,
Yeah.
honored, and it's a very exciting time for our state to move forward in this direction. And I'm just beyond thrilled to be able to work with our partners and obviously the employees of the state agency to just really drive our mission forward. So I am lasered in on that mission and will continue to drive our success forward. So thanks, Melissa.
Yeah, thank you. And I encourage everybody to look at the Governor Kelly's announcement. It gives you a very lengthy history of Christy's work in this space. And really excited and I'm happy that Christy is a panel member. One of the things that we really looked at charging our ecosystem work group, which Christy serves as a lead on, is how do we support the Office of Early Childhood? And who knew that she'd be supporting the work so intimately? So very excited to see, and I know that she is happy to hear your thoughts, and very open to, I think of when I equate Christy's work, I think of very openly as a thought partner. And really appreciate that sentiment that she has offered to the panel and to myself. And so looking forward to that. So congratulations again, Christy. All right, Lindsay, if we can move forward. Okay, so we have sent out today's agenda earlier this week, which included today's agenda. Still, I think I'm in denial that it's December 19th. And we are one week away from being on the Christmas, the day after Christmas. So that really is disconcerting to me, as I don't have my presents all purchased. But we're here, we're laser focused. Appreciate everybody that's joined. We send out the November minutes. So making sure that all of those, we'll move forward here in a moment, making sure that nobody has any comments about those. I'm really happy to have the Help Me Grow group with us this morning. We're going to talk about our work groups. Sarah Gardner from KUCPPR will be joining us to talk about the monitoring dashboard, which I think you are guys going to be really excited about. And we're going to wrap up with some key takeaways, and then we will let you adjourn into your work groups. So we have 2 action items. And so if there's no comment about the December agenda, I would ask for somebody to come off mute and please introduce themselves. And then we will make a motion to accept the December agenda.
Desiree Straight. I motion that we approve the December agenda.
Okay. Thank you, Desiree. Do we have a second?
April Sherman, and I second.
Okay, so if we could take a quick vote on that. Everybody wants to raise their hand that they approve adopting the December agenda as presented. Okay, if anybody disagrees, same sign. Okay, the motion passes. And then we're going to go through the approval of the November minutes. Can I have somebody make a motion that we approve the November minutes as presented?
This is Maritas. I move a motion to approve the November minutes as presented.
Thank you. Can I have somebody second that, please?
This
This is
Brenda.
Tammy Benham. I second.
Okay, thank you. If we can raise our hands and have a vote on that, I would appreciate it. Thank you. It looks like the motion has, do we have same sign of anybody who disagrees with the approval of the November minutes? Okay, it looks like the November minutes have passed as presented. Okay, Kansas Open Forum. Anybody listening, any partner, this is an opportunity where you get to join the panel. As again, to still a term that we just use as a thought partner, to challenge the panel with a new idea, to share any insight in any of the work that you are embarking in that we may not be aware of. We would love for you to join the open forum. Again, we did not have anybody join, but we really would love for anybody to join us as a thought partner and share what's important to them at the local level within your organization, within your community. So please, we really do encourage anybody across our beautiful state to join us. But that being said, so not just to fill the space, we do have some Kansas in the news. And I really try to look at and expose myself and the panel to any small local groups that are sharing news in multiple sites. So when I say news, I think of it very loosely, whether that's a social media site, whether that's radio. And I was really excited to stumble upon this Ad Astra Radio. It's a group, it's a consortium of hometown radio stations. And, we're so used to using our Spotify's or our Pandora and using our streaming accounts that I really wanted to, remind everybody that we have great local news, and that comes in multiple ways. And so giving a shout out to the Ad Astra radio station, and they picked up the press release that we had of our zones grantees. And love that we do send local, press releases, and local news outlets are sharing that in a way that, we may not think about. And so they shared our grantees information and talked about the work. And so really now started following Ad Astra, and hope that you guys think about your local resources also and support them in a way that is really tangible to the work that we do. So again, give Ad Astra a follow. Okay, so I am going to turn over our the rest of, well, not the rest of, but the next about 45 minutes to Madeline Wagner with the Kansas Department of Health and Environment. She leads the work in the Help Me Grow Kansas initiative, and just really excited to have her and some of her partners on board with us this morning. I think that as we tie in the work that we did in November, which was really focused in on families, and really, we positioned ourselves in the shoes of families, making some really tough decisions. That the Help Me Grow Kansas work is a continuation. It's on that continuum of how we support families, and what does it mean to, we say support, and I say that very loosely. And what does that look like? And Madeline and her team are going to show us some very tangible efforts that you can really tag on to, adopt, share, and really, again, it's not just a support, with the loose framework. They're, again, with very invaluable next steps to really engage families. So that being said, Maddie, I'm going to turn this presentation over to you.
Thank you, Melissa. Thank you for having me today. Good morning. My name is Maddie Wagner, and I am the Child and Adolescent Health Consultant at KDHE's Bureau of Family Health. And as a part of my role there, I'm also the state lead for Help Me Grow Kansas. So today, just to sort of recap the survey that you all heard about last time, and put Help Me Grow Kansas in this context of the family feedback. What we heard last time was that families are juggling to access basic needs, childcare, and navigate a complex system. These services, they know they exist, but the access is super inconsistent, whether that be because of their zip code, their insurance status, or just different connections that they've yet to make. Success is typically driven by knowing the right person. And when there is that successful connection, it is also typically because of a trusting relationship where family feels comfortable going to receive help. And overall, families just want a simple, coordinated, and human feeling system. Families reported that they need a clear, reliable place for information. They need navigation help without barriers or dead ends, a local familiar entry point, and not more hoops to jump through or lists to read. They want something local and familiar. They also want a support system that is meeting them where they're at, and a system, again, that is built around family experience, and not around system priorities. So that's sort of where Help Me Grow comes in and where Help Me Grow can fit in this framework. Help Me Grow is designed to respond directly to what families are telling us. It is not meant to replace any existing services or create something new for families to figure out. It is meant to connect existing systems, programs, and communities. So it's meant to make existing systems work better, essentially. It's a coordinated approach and it's built around access, relationships, and follow through. So think of it sort of as like the connective tissue or the grease on the gears to help what's already out there connect and work better together. This is the framework structure of Help Me Grow. There are four main components. The first one that I'll talk about is child health provider outreach. And within that component, we really focus on engaging pediatricians, primary care providers, for screening and best practice training. When we say child health providers, we aren't exclusively limiting that to medical providers. We also take an expansive view and include childcare providers and home visitors or anyone at that like social service level providing those services to children. We also focus here on clear referral pathways at the provider level and want to hear how providers are experiencing the system and their feedback on what they're seeing in their interactions with families. The next component is our centralized access point, which is 1-800-CHILDREN. And that's a single central place for families to find help and services and get connected quickly. It's a phone number, but it's also a website, an online database, and they have texting and they can email and all of that as well. So families have multiple ways to access what they have to offer. They have trained navigators that are there 24/7, 365 to answer phone calls or any other form of outreach. And families can receive like warm referrals and follow-up. And there's no eligibility requirements here. They also have translation services. So they can translate, I think it's up to 200 different languages they can provide services for. The third component we have is family and community outreach. And that I feel sort of the heart of Help Me Grow Kansas. And that's all about partnering and having open conversations with families and communities, not only hearing and collecting their feedback, but putting that into action and using that feedback for systems change. And having families be a part of that whole process. So making sure we're including that wherever we go. And also just a lot of the tangible pieces of Help Me Grow fit within this component, which we'll talk more about later. And then the final component we have is data collection and analysis. And this is kind of collecting all the information we're getting from these other three components, along with bigger pulling from different databases and any publicly available information to paint the bigger picture for what's happening in our state when it comes to families accessing service, whether it be referral outcomes, where are the gaps, what are the screening rates, what are the how often are families getting follow-up or following through with referrals. So this is really, I think, what drives the continuous improvement of not only Help Me Grow and our efforts, but the early childhood system and ecosystem in general. It's what makes a case for the changes, for additional resources or shifting resources to help families get the services they need. So the power of Help Me Grow is really in all four of these working together. That's why we have the gear visual here, because it really is all interconnected and ever changing, ever moving. To the next slide. So the top strategic priorities for Help Me Grow and what's at the core of the work, first would be expanding developmental screening access. In the Title V early childhood, or the Title V maternal and child health needs assessment, we found that only roughly 33% of Kansas children are being screened at the recommended schedule. And we understand screening to be the key component in early identification and receiving early intervention, which we know improves outcomes tremendously. So we hope by expanding access to developmental screening to improve those outcomes as well. We want to strengthen navigation and referral follow through with warm handoffs, closed loop referrals, whether that be a centralized referral and intake system, community approach to that, statewide approach to that, finding what works, or tracking outcomes and problem solving barriers to accessing those services for families. We want to support the early childhood and health workforce through training and different tools that we would be able to offer and reduce the administrative burdens there that often are the common barriers at that level. We want to include family voice at every level, so not just hearing that feedback again, but having families be a part of the decision-making process in those decision-making roles, whether that be a one-time occurrence or maybe it's sitting on an advisory board or a council. And really passionate here about paying families for their expertise and finding ways to really accommodate them in that way as well and appreciate their contributions. And finally, the kind of catchphrase is that no wrong door approach. So whether families are in schools, childcares, pediatricians' offices, libraries, wherever they're at, we want them to be able to have access to everything that is there for them, that whether they kind of are looking for it or not. We want that information there and accessible at every door, and break down those silos between the different services. So this is sort of the behind the scenes, I guess, components of Help Me Grow. It's housed within within KDHE and the Bureau of Family Health on the Title V maternal child health team. So that's where my position sits. Our centralized access point, as I mentioned earlier, is 1-800-CHILDREN, and that is funded collaboratively through a multi-agency agreement. A lot of the data we get is not things that we're necessarily going out and collecting, but through the early childhood data share agreement, the ASQ Enterprise Iris Find Help, which is what 1-800-CHILDREN uses for their searches on their site, Daisy, which is the Title V age local partner system, we're able to make those connections and leverage that data as well. And it's all really strengthened through those community partnerships and implementation support along the way. And then I just wanted to kind of brag a little bit about the work 1-800-Children does and their connections they're receiving with families. This is data from 2024. So we are in the process. We try to get that full year picture. So 2025 will be sending out that information shortly by the end of January. But just some quick facts. The thing I'm really proud of is the stat at the bottom that 96% of individuals or families reported that their contact with 1-800-Children met their needs. So if we look, Help Me Grow is a national model. It's implemented in over 34 states. We are up there at the top with our centralized access point needs met rating. And I think that's a huge contributor to how families are experiencing not only our centralized access point, but the overall ecosystem. So wanted to brag a little there. And all of the Help Me Grow work, I don't know how many times I said collaboration, partners, all of that in the beginning part, but it all revolves around that collaboration, the partnership. And that can be broken down into different levels. I don't know if we have the poll set up. It's okay if we don't. It's okay. We can reflect on it instead. Um, but briefly, we'll dive into each one of these and how they look in our state and how they could look in our state in a bit. But briefly, systems level collaboration shapes access and availability. Community level creates local entry points, and that program or systems or service level is where families are really interacting with the ecosystem. So Help Me Grow aligns these layers so families don't fall through the cracks. I think it's a good reflection point to think like, where does your personal work, where does the panel's work fit into these levels of collaboration? And how do you see them intertwining in your day-to-day? Go to the next slide.
Sorry, I was trying to see if I could set that up really quick, but sorry, Maddie.
It's okay. It's okay if not. Reflection
Okay.
question
All right.
instead. Yeah.
Thanks.
So we'll start by looking at the systems level. And that again is the system or the structures that shape the access and availability to the early childhood ecosystem, to child health services. Things that shape that in our state are things like strategic action plans, state level priorities and objectives. Some really great examples of that and work we've seen in recent years are the All In for Kansas Kids strategic plan. We also have our maternal and child health state action plan that runs on a 5-year cycle. We're about to go into the new one, so really excited for that to come out soon. 1-800-Children as the centralized access point for Kansas families is also a great example of that systems level collaboration, with it being multi-agency funded. They kind of have investment from different the different corners of the early childhood ecosystem. The systems level collaboration is also built through shared awareness and goals, data partnerships, and operationalizing collaborations through agreements and the leveraging of resources, which is a long way to say putting it on paper, putting these partnerships on paper, and making that an official part of the system instead of just that person-to-person agreement, making it a system-to-system agreement. So it's all about policy, infrastructure, and sustainability. The next level we'll look at is the program and service level. So we can go to the next slide. And this is all about how families experience the system, how they feel about the system. This kind of collaboration can look like building referral pathways and partnerships, shared systems. So whether that be an online system like the ASQ Enterprise, or maybe it's a centralized intake or referral platform like Iris that the community shares. But building those central channels for families and services and programs to be able to connect on. That also looks like individual program or service level policy and procedure change to remove barriers. So that could be universal eligibility for a service, mobile services, or sliding scales, just looking at ways we can reach families that aren't necessarily already being reached. And maybe that's through collaboration and braiding of funding between programs to be able to fund or offer something like a mobile service that one program can individually fund itself. We also fit workforce development and training in here, and then messaging and promotion, communication, how we're showing families, how we're telling families about what we have to offer, and really being clear in that information. So this is where families really would feel the difference in that collaboration. The next final level is that community level. So this is where families are reached. These are the entry points. And collaboration here looks like integrating a community-wide or sector-wide, I would say. So like a health referral platform or like a social service referral platform within that specific community where the community services are talking to each other. This is having developmental milestone resources and developmental health resources available wherever families are. This is also where access to screening fits in. So it's not just 100% on a child health provider to be providing it, but where else can we fit these screenings in to families that might not be present in that health provider's clinic, or that might not be present in a child care setting, finding ways in the community to be able to offer those. And not only offering them, but that local resource navigation or care coordination, that person or program or that go-to locally that really knows the local community, the ins and outs, has personal experience, and is that best person to show families the way and guide them through the system, and make those warm handoffs and connections. So this is what is most visible to families. And I think this is where most see the actionable pieces taking place. And yeah, so those three levels are kind of where Help Me Grow works in coordinating that collaboration. We'll dive into next a couple examples of these so we can share a little bit about what's been happening over the last couple of years and really like solidify that image of what Help Me Grow Kansas, what the Help Me Grow framework has looked like in our state recently. So I'd love to welcome Rebecca Benson. She's a professional development specialist with Casito Infant Toddler Specialist Network. Her and I have been collaborating on the ASQ and partnering with childcare providers to provide wraparound support. So Rebecca, if you could share, I think she has a few slides about kind of where we started, your work with Infant Toddler Specialist Network, and how we've been working with providers. I would love to, yeah, have you share.
Good morning. Again, my name is Rebecca Benson. I'm a professional development specialist with Casito, an infant toddler specialist network. And we are a grant funded program from DCF and the CCDF funds. And our overall mission is to provide high quality early education and care. We do professional development and support through technical assistance to support those who work with children throughout the day. So yeah, that's our overall mission. What we do in-person, live, virtual, and online trainings. And we do on-site and virtual consultation and coaching visits that are voluntary and free to providers. We assist with the CDA and national accreditation supports. We do targeted goals with providers through quality enhancement plans and can provide some materials to providers through those targeted goals. We also have scholarships for professional development. And we'd like to give lots of resources and links to state and national resources. And flip for me. There we go. And our coaching services are both one-on-one or small group guidance with one of the professional development specialists to improve or enhance the child care programs and their practices throughout the state. We're very flexible on format. And again, we are at no cost to the provider. And we do supports in all sorts of things. There's not really a limit, but some of the more common topics are child development, classroom environments, inclusion, developmental delays, disabilities, mental health, and social emotional supports. And right now we're seeing social emotional supports and child development as two really main ones that we're seeing right now. And we began in the spring with an ASQ pilot, and at that time, our target was some larger centers across the state of Kansas. We have a number of ASQ trainers on our staff, and so we're providing the training and then getting them hooked up with the ASQ online system and helping them navigate that. Helping them get that information out to families, having families fill out the questionnaires, and then doing some follow-up with what now do we do with this information? We have this information, on these kiddos. What do we do now? Is it a referral? Do we need to help them change things in their practices and their centers to better support children? So what that after part is. And then this fall, we started collaborating with Maddie and the Help Me Grow with the Books, Balls, and Blocks. So we are providing the training for centers. We're attending the Books, Balls, and Blocks as a resource for families. And we're all again offering that follow-up to the event for how to plan for conversations, providing resources, and identifying the strengths and areas of growth for the kids and for their programs. And then this fall, this winter, we are starting a family child care ASQ support to help get family child care on with doing the ASQ for families, and also helping not only the larger centers, but the family child care set up a schedule for online monitoring, continuous monitoring for children at about an every 6-month schedule for that online monitoring for growth and development. So yeah, it's been a great collaboration with Maddie. We've done well together. So doing some more in the future.
Yeah, thank you, Rebecca, for sharing. I think like our big idea was to be able to braid our different grant funding. Help Me Grow has some PDG allocation for Books, Balls, and Blocks, which we'll share a little bit about here in a second. And we heard or someone reached out from Rebecca's team hearing we were doing work with developmental screening and ASQ, and we were able to make that one-to-one person connection and kind of materialize that into wraparound support around the ASQ for childcare providers. So with Casito, Infant Toddler Specialist Network, being able to provide the training, the follow-up support, and Books, Balls, and Blocks with Help Me Grow being the implementation piece, giving providers the tool of the how to get families to fill out the screenings, how to implement them, and also the materials or the resources providers need to be able to offer this to families. So we have a short video here put together at one of our Books, Balls, and Blocks events to be able to just show a little bit about what one of them looked like. So we can watch that now.
I
just set up for a Bucks Box and Balls event. These are developmental screening events that we do at numerous daycares, or also it can be at community events. Here we're just setting out all of the materials, getting the iPads ready for them to complete the screeners. We have bags with some resource folders in them, some puzzles, lanyards with 1-800 Children's contact information, and we have some hot balls and some ice packs. Then we have our setup, so we have our people in box station, our balls, and books. That's it. So you'll see Allie and I, running around there, setting everything up. But we try to make it as fun and engaging as possible. We have books from Dolly Parton's Imagination Library there. We have resource bags for families to take. We have different play and activity centers for the kiddos to be at while parents are completing screenings. And that also doubles as those are most of the materials needed to complete the ASQ or things the ASQ asks about. So families can actually go have the materials there. If they aren't sure if their child can put blocks into a bowl, they can test it out right then and there. So we've had a lot of fun with these events. We have heard great feedback from childcare providers. So just a few more pictures. And then the next slide is a little bit more information. Our pilot year, our goal was 3 events. We ended up having 5 because of the interest level. We had 82 ASQ screenings completed and handed out 264 resource bags and folders reaching all geographical areas of the state were frontier, rural, and suburban families. The next grant year runs October through next September, and in October we had 3 events completing 106 ASQ screenings. Families completed 106 and handing out 129 resource bags. So I think we definitely learned a lot in our pilot year, and to see those ASQ completion ratio to resource bag ratio, which would basically be a family count, is something I'm super proud of and really excited to see unfold further this year. And I think that also has a lot to do with the preparation, support, and training that Rebecca and her team provide, really helping providers understand the purpose, meaning, and being able to pass that on to families as well. Our next spotlight here is going to be from my coworker, Allie, who I've been mentioning. She helps support Books, Balls, Blocks, among any other things. She's the KDHE Family Systems Consultant and also the Family and Community Outreach Lead for Help Me Grow Kansas. So Allie's going to share a little bit about the Family Leadership Training and Family Leader Initiative.
Hey, thanks, Maddie, for that intro. My name is Allie Braun. Like Maddie said, I'm the Family Systems Consultant for the Kansas Department of Health and Environment. And if you'll actually go back one more slide, yes, I'll start on this slide here. So today I get to tell you guys a little bit about the family leadership training that's in development right now. So we developed this training because we've heard a need from across the state, from families and providers, that there was a need for a leadership training to kind of help with advocacy and helping parents kind of figure out where to even get started with that and how to do that. So this initiative is going to empower individuals to become strong family leaders within their communities. So if you'll go to that next slide, please. So these are our family leaders. Whenever we were developing the training, I really wanted to have families at the forefront. So like we talked about in the Help Me Grow system, we want to include families in everything that we do and not just have them like reviewing things, but really in the process of development. So we do have our wonderful family leaders here. Crystal is from Northwest Kansas, Jenny is from South Central Kansas, and Erin is from Northeast Kansas. So we did this really really intentionally. We did have interviews with family leaders to get this word out for the training. And so whenever we were putting together these family leaders, we wanted to make sure we picked intentionally from across the state. So we wanted to have some within rural areas and then also some within urban areas to making sure that we were getting all the needs from families and across those different areas within our state. And then if you'll go to the next slide. So the goal of the family leadership training is to know more about how to work more effectively with partners, to become more aware of the pathway to leadership so they get to discover where they're at now and then how they could move forward in their leadership journey. And then discover new strategies for advocacy, share a community service project that impacts the community or the system. So that is the main goal of the training, is they'll develop that community service project and at the end be able to work towards that or complete it. And then have the support throughout the way to be able to do that. And then we also have an opportunity to serve on the Help Me Grow Kansas core leadership team as a family leader. So whenever we were developing this, Maddie and I put our heads together and we were thinking, how can we pay our families? Because that was definitely important, but also how can we collaborate on this? Because Maddie was needing a family leader and I was wanting family leaders to be able to develop this training. So we put our heads together and we decided to partner with that. So they'll start with me right now in developing the Kansas Family Leadership Training. And then once that's complete, they'll work more with Maddie with some Help Me Grow work. And then eventually those leaders will transition out. And then once our new cohort starts, once that family leadership training is developed, the family leaders will go, or the cohort will go through, and then at the end, there will be new family leaders that will be able to work with Maddie if that's an interest for them. So very exciting work there. We do have a website, so it is in development. So keep your eye there for more information to come for that. So Maddie, I'll pass it back to you.
Thanks so much, Allie. Our next spotlight is going to be the Family Advisory Council, the KDHE Family Advisory Council Early Childhood Work Group Special Project. Tiffany could not make it today, so we recorded a little interview video, so we can watch that now. All right, well, we could get started. Tiffany, thank you so much for meeting to do this little recording. If you just want to share a little bit about yourself, your involvement with the Family Advisory Council and the Early Childhood Work Group, that would be a great way to start.
Absolutely. So I'm Tiffany Bartley. I am a supervisor at Kansas Children's Service League, and that's my daytime job, as they say. And I work as a supervisor for the Healthy Families Program. One of them, we have two. I'm a supervisor of one of them. I was introduced to the FAC probably about 2 years ago, and have been in the early childhood work group from the very beginning.
And I think it would be great to share with the panel a little bit about your special project and kind of how you all became involved with the Help Me Grow work and kind of where that's heading.
Yes, we are so excited about that work. Our group started actually working with 1-800-Children and just kind of going through and seeing if there were anything that we could add to it or any resources. And we quickly found out that 1-800-Children is amazing, which we know, and that they had a lot of the things that we were putting up to add. They already had a resource for it. So it kind of created a need for us to find a new focus. And as we were in this process, you entered with the need, and it fit our group perfectly. So did you want to share what it is that we're doing, or what did you want me to?
Yeah. So I was asked to come meet with the early childhood group because of the Help Me Grow Kansas work. There was a lot of alignments that Allie was seeing between what Help Me Grow was doing and sort of the ideas that the early childhood work group were having. And so I came and kind of just threw everything out there of like, here's a list of 15 things that I would love to do. What are you all passionate about? And what do you feel is important? and you guys kind of took it and ran with it. So the main focus of the project is around developmental screening and availability. If you could share a bit about like how we got there and narrowed it down.
Yes. So we started with, after you sent us that lovely email with choices, we decided developmental screening and making sure that there was enough developmental screening places within the counties within Kansas. What we found out was that the need really focused in on the rural counties. So as we started our work and finding resources in counties like that are around us, like all the counties, we decided to narrow that project. That became a little too big and a little bit unnecessary in some counties that are bigger and more populated because there are plenty of screening availability. So it really created a focal point for us to do rural counties. And so that's the stage that we're at now. We have each member of our group is responsible for a county or two or three, depending on how it laid out. And we're in the process of finding out exactly what is available in these counties and how close are they to having developmental screenings for children, because we know that the earlier it gets caught, the earlier and the higher success rate of, them entering kindergarten completely on schedule or with the necessary helpful supports that they need.
Yeah, I think the push behind this is to identify, like you said, Tiffany, like what's there, what's not there. And then with the end goal being like, how do we communicate the availability to families, but how do we also communicate the lack of resources or accessibility at all different levels, the state level, the community level, and to have you all on the project, like boots on the ground, doing this research is.
Yeah, I mean, and that's the next step, after we get these identified rural counties as to what is available, the next thing we're going to have to do is get into those counties, right? And actually find out, okay, what do we do to help them? What is the answers? So it's not going to be enough just to gather information. It's going to have to be a next step process. And that will be the next step, is to, reach out to libraries, reach out to things that are available in the community. And can we get those services in there? What would that entail? So it's definitely an ongoing project. It's not something that's going to be completed tomorrow, but it's very necessary. And I think it will be super impactful.
I'm so excited to see it unravel, and just want to say thank you again for the group's hard work and dedication to this shared goal. Yeah. Well, thank you so much, Tiffany. I think we can wrap up the recording.
And thank you for giving us a direction and being a guide. And you're always there when we need some guidance or have questions. So thank you as well.
Of course. So that I think is a great example of what it looks like to put family voice at the center of our work. And like I said in the recording, super excited to see where that project goes, and to be a part of it has been an honor. To kind of wrap this all up into a bow, families need simplicity, and the Help Me Grow framework builds that clear path. They need trust, and Help Me Grow tries to offer that relational access point and build those relational access points in communities. So not just our centralized access point, but helping communities build that locally. Families need that follow through, and the Help Me Grow framework works to strengthen referral systems, build those partnerships, and shared investment in those different collaborations and referral streams. And then families need consistency. So the Help Me Grow framework is the model for aligning statewide and local partners, and kind of helps guide both the state and local partners in what that partnership might look like. So we hope the Help Me Grow framework help solve the problems that families have identified, not only in this survey, but in all the family feedback we hear and in their everyday experience. Next is the what's next. So what are the actionable things here? How can we all be a part of the Help Me Grow framework model? So how can you help support this work? Number one is to help promote the Help Me Grow framework in your work. So whether that be integrating it into local strategic plans and initiatives, sharing the model, or just the idea with your network or partners, and positioning it as the coordinated approach in your region and at the state, and help spread awareness of what's working. You could help by strengthening developmental screenings in your setting. So encouraging usage of the ASQ or Ages and Stages questionnaire in the ASQ online enterprise, which is available statewide, not only for, the kindergarten snapshot, but also for different childcare programs, health clinics. We can get just about anyone on there. And making screenings or championing screenings as a part of the routine, not just when there's concerns. You could host a community event like a Books, Balls, Blocks event, help identify host sites and connect Help Me Grow Kansas to local partners and outreach channels that may be interested in this Books, Balls, Blocks developmental screening event style or model. In request events in underserved areas you may know about. Can expand awareness of 1-800-Children by adding it to newsletters, trainings, including it in family-facing materials, and kind of making it the go-to referral for families who are seeking support. They not only help with developmental health questions, but a wide array of different referrals they can provide for economic support, food support, education support. They can answer just about any question or get you to someone who can answer just about any question. It can help connect families to the Family Advisory Council or similar family leadership opportunities, identifying families who may be ready for this leadership role or may be ready to attend the family leadership training, who are passionate about community connection and support and being a part of the system, and creating pathways for families who may not know that that's even an opportunity yet to be a part of that systems level work. And then finally, sharing data and insight. So this helps us identify different service and screening gaps, share what navigation barriers families may be facing locally, and provide feedback on what is and isn't working. I think the bigger picture we can paint, the better we can understand where families are falling through the cracks, where families are succeeding, and how the early childhood ecosystem support system can evolve to help support families better.
Maddie,
And
I
then,
think we have a few questions too.
yeah,
Has someone raised their hand if this is an appropriate time to ask a question?
yeah, that's my next slide. So that's perfect.
Perfect.
Tammy, I see your hand raised.
Thank you so much. And this has been very helpful and very informative. Thank you so much on behalf of public libraries for mentioning public libraries as an access point for families and for recognizing that. This is actually something that we've been discussing in one of our work groups. And I just want to offer the potential for you to contact me as that conduit between the early childhood field and the library field, because I literally work in that field and have early childhood experience. I could help open some of those doors for you or give you a bigger picture of of what's going on within the system. I actually have email right now from libraries in different parts of the states asking about the ASQ and what that might look like in their library. So this is very timely for me and very interesting information. So I'm glad to see this is happening and thrilled to be able to work with you potentially in the future.
Yeah, Tammy, that's super exciting. So that's sort of been like my next step on my checklist going into this next grant year is finding those community partners, specifically libraries that are already hosting family events. So I would love the opportunity to collaborate here, and really excited to hear that there are libraries reaching out, inquiring about this, and already interested. So that would be wonderful. If you want to, yeah, take my email down or put your email in the chat, we can definitely connect on that.
Great, thank you.
Thank you. Yeah.
Do we have any other additional questions for Maddie and her team that she brought today? All right. Well, I want to personally thank Maddie. We challenged her when we asked her to come present to the panel to bring her village, right? Everybody that supports the Help Me Grow and all of the different entryways. And when we talk about systems work and really amplify that within the panel, I think the Help Me Grow presentation really knocks it out of the park. I really appreciate it. First of all, the visual of Help Me Grow. I love the moving parts because families aren't stagnant. They're constantly evolving. And if we as a state or as a system don't evolve with them, then we are doing them a disservice. So even down to your very intentional visual helps you really understand Help Me Grow and appreciate it. Just and I might be oversimplifying this, Maddie, but your conversation with the Casito partners, and then how that grew into reaching a larger segment of the population. Very, very excited for the partnership moving forward with the family child care homes. We should not discount. I know your intention with child care centers, a lot of kids, lots of families, but really appreciate the mindfulness of reaching out to family child care homes, looking at the library. And I think what the panel really tries to hone in on key takeaways. And I'm going to have one right now, really looking at the braiding. I know we say that a lot, like, oh, let's braid work, but you really took that to heart and you move that forward. And with the work that you guys are doing in the States. And so I think a key takeaway is what can we do better with limited resources? And you have really, again, hit that out of the park and cannot wait to hear in our governance summit moving forward, looking at the Family Advisory Council and the Family Leadership Team, what you guys are doing to support the system. And I'm really going to tease up January's presentation because we've been really, my intent is to be very mindful as we build across the panel presentations. And we started with ASQ here as a conversational point. And then we're going to have a kindergarten readiness presentation, which really ties into the ASQ and what we're doing. So just really wanting to let panel members know that when we bring folks and organizations to the panel, that it's not just to hear information, but it's really at a systems level. And then how do we thread that through moving forward? So, and also appreciate it, shared with Maddie, like, get creative. What do you want to share? Don't just present, bring your village. And so she really took my charge up and loved the thoughtfulness. And I felt like I was, I'm going to date myself, but felt like I was sitting in an Oprah conversation when, you were having your one-on-one and really just appreciated that. So thanks for giving us a glimpse of the Help Me Grow work that you've done, Maddie, and I cannot wait to see what you and your village continues to do for the families in our state.
Thank you so much. And thank you for the opportunity to share as well.
All right, thank you. So we're going to talk about, go into our work group discussions. And I really do think what we heard with Help Me Grow is important because it's sets the tone for what we're doing. And my goal within your work group discussions has really been to make sure that you have tools and you have access to what's going on in our states. And that being said, we're going to share our bright spot earlier because I really think that it shares tools that you have. I had the opportunity to participate yesterday in the Coalition of the Willing. And I just love that, right? Because that's what the panel represents, is a coalition of the willing, because you don't have to give us 2 to 3 hours a month. You don't. You apply. You want to be a part of this ecosystem work. And so you are a coalition of the willing also. So I'm like, oh, I love that. And really wanted to share that. But the takeaway that I took from yesterday was there was a gentleman that participates in their group with their Workforce Alliance. And it's Keith, and I think I want to make sure I'm pronouncing this right. So Mandy, well, if you want to come off if I mispronounce Keith's name, but it's Keith Lawick with
Lawing. It's lawing.
Okay, lawing. I appreciate you because I would not want to get that wrong. And I appreciate his quote. I heard this multiple times in 90 minutes. Quit admiring the problem. Like really quit admiring it, because we can do that a lot. We can tend to get into a space where we just like look at the problem and we just recycle it over and over again. So really appreciate that we started with this really transformative news of the appointment of the OEC director. And here we are talking about work groups. And Keith, really, if we take up Governor Kelly's charge, we're not admiring the problem anymore. We're moving forward. And so really want to make sure that, that you in your work groups, that you, within your small coalition of the willing, that you are looking at what can we do to better our system moving forward. And plus, Mandy probably didn't see this. I had to take a picture of her. Like Mandy Waugh is part of our panel, and she is spearheading this business, and it's very business focused, which I love. And she really set me straight. I'm like, this is what we're doing, and this is what we're looking at businesses. And but it can be easily replicated in the work in our work groups. And we do have a family-friendly work group, and some of the things that they're looking at. And then they had just a great conversation. And it wasn't just to those in Sedgwick County. And in fact, I love the executive director of Child Start, Tanya Bullock, really said, we're excited to see what can happen across the whole state with this work. And we had a gentleman from Stafford County join. And so it was just great. We had representatives from Child Care Aware. We had Sarah Bloom from the Department of Commerce. And so it was just, I told Mandy, and I jokingly said, I was so excited, and this is how you prioritize your work, because I decided to drive 2.5 hours across a very windy day just to make sure I was there, because this work is important and showing up is important, and being at the table. So just wanted to really set the tone with that early bright spot as you move into your work groups today and some of our summary. So Lindsay, if we can go to the next one. So just reminding everybody that we have 4 active work groups this panel go around. We have the ecosystem with the ECE collaboration. We have family-friendly workplaces. We have targeted journey, and then we have our mental health supports. And then guiding principles that I use and that I hope you guys do, because everybody has access in our SharePoint to look at, snoop around, see what your other work groups are doing, making sure you're not duplicating, is that we review work group content. We honor the placement of each group. If some of you are still in the exploration stage, good for you. Ask questions. That's one of the things that I took away from yesterday's meeting is another of their panel group has said, be curious. Like she said it over and over again, be curious. Like that's the way you move past to just admiring the problem is be curious, and there's no wrong question. Elicit discussion, bring people into your work groups. I have really been excited of how many of the work groups have been curious and asking others to give information. And then again, when we have cross collaboration opportunities, really, get on that. And I think Tammy really just exemplified that just a few minutes ago of like, hey, I'm going to raise my hand. I'm going to put myself out there and I'm going to collaborate and offer myself to the Help Me Grow team. So love what is happening in the panel this session. And if we can go, I did do some snooping in your last work notes and just wanted to bring some things to, making sure that everybody had opportunity to hear. That when we're looking at the ecosystem, I really think that you're going to have an opportunity. I'm like, pre-setting the stage for Sarah Gardner's presentation to the All In for Kansas Kids monitoring dashboard, that you're going to see in real time data points that are happening, that have happened to really be informative within our state. And then for the family-friendly workplaces, really wanted to exemplify our existing resources on the KCSL website, on the All In for Kansas Kids website, just all of these really good things that are happening in workplaces. And then if you're curious more, invite Mandy sometime in to join your group, and because I know she serves in the mental health group, to ask what's happening in the very specific business sector. And the targeted journey, I think you guys are manifesting into our ecosystem things that are happening in real time. There's a lot of conversation like what's going on in the CTE world in our high school. We have a lot of our zones grantees that are funded through the Children's Cabinet that are asking very specific questions of what is happening in the CT world and how do they support high schoolers moving forward. And so really good opportunity for collaboration with our KSDE partners. We also have a change team in our state who is very specifically receiving technical assistance at a national level to look at how do students in our state get credit for prior learning and what does that look like, and really trying to set the stage on some of those standards. And back to the CTE, I just learned yesterday, because I was, or not yesterday, I think it was Wednesday, because we were curious, like what's happening in the KSDE world, that there might be a new course offered with the in the CTE world next school year that really does tackle some of those CPR first aid questions that you guys have been asking. So lots of amazing things happening. And the mental health group, they're looking at an environmental scan, looking at local initiatives for broader reach. And I share that because we use the term environmental scan loosely. So if there's any other groups, that are also looking at some of those efforts, or if you're, familiar with anything that KDADs may have in place and all of that in your own local communities, please connect with the mental health group, because that's really where their initiative is. So I'm, giving you a 3,000-foot view of what is going on in the work groups, but just really trying to make sure that we are not being duplicative in our efforts. So that's it for a summary. Hopefully we will give you some more time today to really dig into some of the work that you want to do within, I love saying, in 2026, see you next year. And that's just really right around the corner. So that's really what you guys will be doing today. And then Lindsay. Okay, so I'm going to turn it over to Sarah Gardner with KU CPPR. I think I was joking with her on screen on Wednesday. This is I think the first time, or not the first time, the fourth time that I have heard this presentation. I learn something new every time. I'm so excited to share, and really lean into her presentation, because this is going to be pivotal, and where we're starting in January of 2026, and what we will see, and the asks that she's going to ask of you specifically from where you sit, and what we will learn and be able to add to our dashboard in another year is just going to be, blows my mind daily. So that being said, I am going to hand it over to Sarah.
Thanks, Melissa. I tell Melissa every time I give this presentation, she mentioned the 4 times, she says something nicer and nicer about it. I feel like I owe her like $100 at this point when it's all said and done. So I hope that you find something valuable out of this next presentation, and that you find something that you can add to and contribute to, and that you find it to add value to your work and contribute to your work and to your efforts. So Lindsay, you can go ahead and move to the first slide, I think. So I'm going to talk about a strategic plan monitoring dashboard, but I thought I would take one step back. I think I've presented to the panel a number of times on the strategic plan itself, but I just want to remind, we have a monitoring dashboard because we have a plan. We have a state comprehensive early childhood plan that guides our work. So it's known as the All In for Kansas Kids Plan. We've had the plan in place for about 6 years now, and we did a recent update in 2024. The plan itself is the development of the plan was funded by the Preschool Development Grant, and that's kind of where you get the timelines. They come from, they align with that grant timeline. You can find the plan on the All In for Kansas Kids, aptly named allinforkansaskids.org website. You can also find it on the Kansas Children's Cabinet and Trust Fund website as the PDG state lead. So the plan itself represents our state's commitment and the vision that we have for every child thriving in Kansas, which, to the credit of folks who've been doing this work for decades, that has been our vision for a very long time. Kansas has been a leader in many ways in early childhood systems work, in Head Start work, in supporting and providing innovative approaches to supporting the workforce, to advancing an R&R, resource and referral network, and then to really focusing on alignment of home visiting. So there's a lot of things that our state has to build on, but we have found that we have this plan. It's wonderful. It's a lovely document, but we have always said we don't want it to sit on the shelf. And how do we keep it from just being a plan on the shelf? Well, we create something dynamic that people can point to, that people can feel like, okay, we are making progress. We are not a static system. We are a system in motion. We're constantly learning from what is working. We're challenging ourselves to reprioritize and allocate resources differently based on the needs of the families and the children that we serve. So that is the goal of the plan. And so we want to make sure that we have something that we can point to. So you can go to the next slide, Lindsay. So we have a monitoring dashboard. When I talk about a dashboard, what I'm really referencing just tactically, it's an online website, which I think got shared out in advance. But if not, hopefully that works for you all. I put it in the chat. You're welcome to have it up if you'd like. I'm going to actually give you a small tour of it and highlight a few things. So just kind of getting that out of the way. You're welcome to look at it as I kind of talk through some things. The overall initiative aims to establish transparency and shared responsibility. So this is going to be a dynamic, living, breathing dashboard that will update and change. It should update and change, and that's where we need some of your help to provide that detail and information. Our team at KU CPPR is funded by the Preschool Development Grant to support the monitoring dashboard. So when you say, like, who is the we of updating the dashboard? It is myself and 4 of my colleagues at CPPR who are getting information from you all, and then we are doing the work of putting that information on the live dashboard. You can go to the next slide, Lindsay. Why? Why should we have one? I think, the first strategic plan that I was a part of here in Kansas hit right when the pandemic hit, and everybody was so focused on doing the work. And then we get 4 years down the road and we want to look back and say, how do we know we made progress? How do we know where to put our energy and our resources in? And so it's really important that for us now that we're like, okay, we actually need to be able to track and monitor in a transparent way that everybody understands the progress we're making. And people importantly also understand the places we still need to be focusing resources and investments. So first and foremost, it's to help decision makers to better understand what's happening and to hopefully get on the same page around next steps. And those decision makers are not just state level decision makers. Importantly, I know the dashboard, if you look at it right now and you were to read it in detail, you're like, it's a lot of state level stuff. Yes, because that's kind of what we have right now. But it's intended to help decision makers at all levels, whether you run a program, you run an organization, you run an agency, you run a collection or a collective of initiatives, or maybe you're just maybe you're a board member of some place and you're trying to help others understand the decisions they need to be making. Hopefully the dashboard can help with that. We also want to be clear and transparent on what is working and what is not. We want to communicate things that are happening really well. This is where I think the dashboard has a lot of room to grow around what is working really well at the local and regional level. How can we elevate that information? So if I'm a USD in Southeast Kansas and I am wanting to establish an early learning facility, I don't have to start from scratch. Maybe there's something on the dashboard that can help me understand, oh, here's somebody who's already done this, or I'm a childcare coalition, or I'm trying to establish a Head Start facility. Like those are all things we know we are doing in Kansas, and we want to use the dashboard to help elevate those bright spots and promising approaches. Obviously, we want to continue to grow the champions for early childhood in our state, and the dashboard is one way that we hope to mobilize and deepen engagement overall. Importantly, creating shared measurement. What does success look like? What are our goals for our home visiting programs in Kansas? What do we want to see for early intervention? We talked about screening or family referrals. What are our goals for that? How are we going to measure success collectively, or even in pockets? How are we going to measure that success? This is a way for us to hopefully start to establish those shared language and shared measurement of success. And then, as always, we love to elevate bright spots and the good stories and the good work that is happening across the state. Okay, so the current dashboard is oriented into priority areas, which is the navigation along the left-hand side. There is essentially 2 pages for each priority area, 2 web pages. One is what we're doing, which is aligned with the strategic plan goals and actions. The other page is the how we're doing. So that is the page that actually has a lot of the detailed indicators that we are identifying to show progress towards our goals and our actions. That's also the page that will have opportunities and bright spots. And I think I mentioned we're a little thin on some of that stuff right now on the dashboard. We are committed to updating the dashboard every quarter, again, by my team at KU. And this thing can grow and evolve as partners need it. So I think importantly, if it doesn't add value, we shouldn't be doing it. It really needs to be something that people find value in. And so that feedback is really critical for us to know. Is the language helpful? Is the data being shared helpful? Are the stories helpful? It's not a glory project. It's really intended to meet needs and to add value to your work and to the system. And so that your voice is really critical to helping ensure that that happens. The quarterly update is just to give us a cadence. It isn't that we are taking feedback only on a quarterly basis. We're going to be taking feedback 24/7, 365. It's just a matter of having that rhythm so people know the dashboard will be updated on a quarterly basis. Our intention is to go live at your next meeting on January 16th, 2026, and the dashboard itself will live on the All In for Kansas Kids website. Okay, a couple of things I want to talk through. And Lindsay, do you mind if I share my screen as I go through this? Okay. Place current share. Okay. Hopefully you all can see that. So there's a couple things I want to highlight and kind of walk you through the dashboard itself as you're thinking about the feedback you might be able to give and if it's meeting your needs. So first thing, it is a web page. The URL you have that I put in the chat technically is live. We will actually update this URL once the formal dashboard is live. So this is not a draft link. It is a live link. It's just not something we're promoting. So if you have partners you want to share it with to get their feedback, by all means, please do so. The dynamic nature of it means that we can update it and get that information in real time. It's not a static thing. So I mentioned the priority areas down here on the left-hand side. There is a kind of a you are here in the mall map terms here, which is All In for Kansas Kids, why early childhood, about the ecosystem, and then there's a little bit of information about how to use the dashboard itself. You can actually generate a PDF of the entire dashboard in one full swoop, so you can just click on that button there, and you can share obviously as you want to. I'm going to jump down to data and partners. Obviously, it is data from our system and it is partners who are sharing that information. And so this is where we will try and be as comprehensive as possible about all of the data and all of the partners that currently have information or that have information on the current version of the dashboard. Okay, so as I get into the priority areas, important to note, the stuff on here now is what we call next adjacent information. So rather than asking for all of your stuff, getting it and then putting out the dashboard, we opted to put out a dashboard that had things that our team or folks, partners that we knew quickly had data available. So you'll see information. So CAPE, the Workforce Registry, puts out information to the governance board at state directors. Some of that information is on here. KCSL does a wonderful job of sharing 1-800-Children data. That information is on here. Some of the evaluation evaluation of programs that our team has a role in. Some of that is on here. So it is not comprehensive in any way, shape, or form. And just a complete, disclaimer that the stuff on here is to get your reaction to. You will probably see 1,000 places where you have information that would beef this up, or you think this is missing something. This isn't telling the full story. That's the kind of feedback we want to hear. And Lindsay, you should be able to I think you have the feedback form link. If you could drop that in the chat too, so people have that. So this is by no means comprehensive or complete. That's my mea culpa out the gate. It's just we wanted to put something together so you had something to look at and react to versus just, well, what do you mean a dashboard? What kind of data are you looking for? This is really to get you to react to the stuff that we have. The priority areas chosen are not the pillars in the strategic plan. We went back and forth about, well, how do we organize the dashboard itself? We wanted this to feel actionable, and we wanted this to make sense to, even if somebody didn't read the strategic plan, we wanted this to make sense to everybody. And so the strategic plan pillars, ecosystem, workforce, experiences of children and families, those are nouns. They are static nouns. We wanted actionable terms here. So it's like, oh, we want to improve referrals and system navigation. Oh, we want to collaborate to strengthen. We want to expand access. So we tried to use that language to kind of clump some of the goals and the actions. This might be something where you're like, yes, some of these are priorities for me, but as an organization, our priorities are something a little bit more nuanced or a little bit different. That is feedback we'd love to know too, so we can make sure your work is represented as much as possible. So I mentioned each priority area has 2 pages. So there's the main page. I'm going to go to expanding access. Has a main page. It has a what we're doing. And so this first section, these are actually plucked directly from the strategic plan itself. And then on this page, or on every one of these main priority area pages, there is a list of initiatives. These initiatives are where we can convey that the system is doing something. It doesn't mean that we're going to show you data or progress measures from each of these things. Sometimes it's enough to be like, hey, stuff is happening. We don't have a lot of data behind it. We don't have like nice, neat numbers or nice, neat stories, but we want to highlight that we are doing interesting things. So one example of this is the small center pilot. It's something that doesn't have a lot of data behind it, but it's a really promising practice that our rural communities are finding very valuable, and it's important that we highlight it. So that's the kind of thing you would find on the initiatives. Same with childcare assistance. There is so much data around childcare assistance, or the subsidy program that is funded by CCDF and managed by DCF. But it doesn't mean that we want to share all of that data necessarily, but we do want families and we do want communities to know that childcare assistance exists, and it is a wonderful resource that families should know about and should find a way to access to get some support to provide to fund childcare. So then if we click underneath and we say how we're doing, this is the area where we are getting into the meat and the potatoes of the dashboard. So this is where we are actually starting to show progress indicators. And this is, and, a lot of thought has gone into this because we want to make sure that the data is not just out there without context. So the beauty of this tool, this platform, is that we can write a lot of content here. We can put hyperlinks to things because we want to be able to communicate the story of the data. A data point on its own can fall flat. It can even be misinterpreted, by folks who maybe don't understand the content. So this is where you all as experts get a chance to say, I actually want to talk about young children living in poverty. What's that number? And let's tell a story about that. What does that actually mean? And why does our system care about that? The other thing I'll highlight with this particular page, and there's a lot here. Let me see if I can go down to, okay, let me go down to this one. So expanding access to childcare. When you see these arrows here, this just indicates that there are several data points behind this particular topic. So you can kind of scroll through. We know this isn't terribly intuitive, so we're trying to figure out a way to maybe do a little video to show people on the main dashboard page. But essentially, this is where we get to kind of cluster the data points that help tell this bigger story. Expanding access to childcare is incredibly complex. There's workforce challenges, there's facility challenges, there's compensation challenges, and that's just on the supply side. Then you have the demand side where families need to be able to afford childcare. They need to be able to find childcare. They need to be able to find high quality childcare that meets the needs of their families, something that's close by. So this is the tool allows us to help break down that nuance a little bit and tell a bigger story. So you've got the topic, expanding access to childcare, and then you've got sort of the cluster of data points that taken together help tell the story of what we need to do more of and what we are doing really well, and where we might have gaps. When I say data, this is another good example. Sometimes it's just a number. It's just a single data point, 11,018 licensed childcare slots added in Kansas over the last 4 years. I think that's pretty awesome, by the way. Just want to call that out. I think that's pretty great. Other things don't have any data at all. They're just stories. They're just narrative. They're just saying, hey, this is something happening and we should talk about that. That's also data. Another one is, we have maps. We have the ability to put graphs and charts in here. So there's all kinds of different ways for us to use different data visualization tools built into the dashboard. Admittedly, right now, it's a lot of here's stuff. Here's things happening. Here's single data points. Over time, we would love to be able to start to show trends so we can start to see how we are doing towards the goals that we have in our system. The other thing that the dashboard allows us to do, it's connected to a tool called My Sidewalk. And My Sidewalk actually has its own data warehouse. And there's about 4,000 different data sources that are publicly available. Things that come out from the federal level or maybe even the regional level that are just publicly available. So poverty data is one of those things, housing data, wage data. There's lots of stuff like that. All of that is already embedded inside of the tool. So let's say this is a really good example. We want to prioritize early childhood mental health. We know that that is a need. We also know that because we've got this publicly available data, we don't have near enough mental health providers inside of our state to even come close to meeting the need. So this is a way for us to show, okay, how does Kansas break down by county, the number of mental health providers? This doesn't tell the full story because this is mental health providers overall. This isn't talking about folks who understand the nuances of providing mental health supports to B to 5 population. So that's just a nuance that we get to explain. So we are able to kind of cluster this and tell this story using data we provide to the dashboard, as well as data that's already kind of in it that we can pull out and draw out. So I wanted to highlight that there's a couple different ways that we can bring data in. The other thing is anytime you see one of these little, I know it's probably small on the screen, but there's a little sort of link icon. There should be one next to every single data block inside the dashboard that you can grab that link and you can put it into any of your own materials. Maybe you're doing a presentation for a board. Maybe you're putting something on your own website. These are live dynamic links. So as long as you're pulling the link directly from the dashboard and that data point gets updated, the place you have put that data block will update as well. So it's never static data. That's the beauty of it, is it's always dynamic. Okay, I think I indicated this at the beginning, but it's a lot of big picture statewide data, and there is a ton of opportunity for us to be more nuanced and to be more thorough here. Melissa referenced, I gave a presentation on Wednesday. I talked to the state home visiting leadership team, and they were talking about, I think we have some information about universal home visiting in here, but we don't have numbers of, where is Head Start and Early Head Start? Where is Parents as Teachers? Where is our Healthy Families America program being implemented? What is our coverage in home visiting in Kansas? What a beautiful map that would be to convey on here. And then that would be something we can show over time. We're actually increasing family access to home visiting. The dream would be to show more families get home visiting means that more kiddos enter kindergarten ready to learn, more families are supported. I mean, you can just see like sort of the longitudinal opportunity that we might have here to be able to tell the story of how investments in early learning and early education and early childhood pay off in the long term. So that's a way, that's maybe a vision for how we can use the dashboard in the future. But because we can cluster, we can talk about each of those home visiting programs individually and collectively. We're able to kind of accordion out that story and really communicate the nuance without being overwhelming or without losing our audiences. So I think that's all I wanted to share on the actual dashboard. Lindsay, you can go back to I think I might have one more slide or maybe two more. So I mentioned feedback. The feedback form is in the chat. That will be evergreen. There is a button on the dashboard called Collaborate with Us. You can click that button anytime. You can tell us bright spots. You can share stories. You can share, hey, I want an initiative on the dashboard. I'd like it to go here. Or de-identified aggregate data. There's no PII on the dashboard. This is like, we don't want to have to go through those hoops. This is like publicly facing something that can be available for everyone to look at. So when we think about, well, what data would I share, maybe you have a report you already compile for a funder and you want to communicate that information. Maybe you have maybe you have a pilot you've done that you want to talk about the lessons learned from that. That's something we could share. So don't let the word data make you think only of numbers here. We're talking about insights. If there is data that actually has different points, yearly or quarterly that we can show that trend, that's great. But that doesn't have to be the only threshold for what we're talking about when we mean sharing data. So I know that's still a little bit vague. Hopefully the stuff on the dashboard gives you some inspiration for the kinds of things you might want to share or you might want to put on here. Also, my ask, I think, is a little bit help us curate so it makes sense to the folks you are talking to. This is admittedly, 4 people putting this together and like putting it out into the world and hoping it's landing. So we want to know from you all, is it valuable? Is it helpful? And how can we continue to strengthen it? How can we continue to share the insights and the initiatives that are happening all across our state, not just statewide, but in pockets as well, and communicate that information on the dashboard. So I know, Melissa referenced some of the different panel working groups. Those are clusters of activities that you might have 4 or 5 different things happening, each with their own data point. The dashboard allows us to tell that story holistically while also still calling out the individual strides and the individual efforts that have been made. So we are taking feedback at all times. The quarterly cadence just is so we have a point where everyone knows new information is going to go up. When we say update, we don't just mean, oh, it's the same data, just new. Sometimes it might be the same data. I know we have CAPE data pretty much every week. CAPE data is changing, right? So we could have something new for CAPE every quarter. But other things, it might be, hey, we wanted to share it this quarter, but we want to share something else and something different next quarter. So it doesn't necessarily mean that everything on here has a quarterly cadence to update, but it means the dashboard itself, we promise to have new insights on that dashboard every single quarter. So if you're sharing something with us, in February, know that will come out in April. If you're sharing something with us or March, if you're sharing something with us in April, that will come out in June. So we're trying to give people an understanding of when this thing will be updated. The current version, we would love your feedback through end of day, January 6th. I know it's a really hard time of year to ask people to do any deep thinking about data, but if you are able and you have some reactions or some thoughts to add, we'd love to hear it. And then we'll have a little bit of a downtime between the 6th and the 16th so we can get everything up on the dashboard itself. And then I have a final couple questions to just leave you with that I think are beyond the logistics of the data itself. I mentioned, why do we have this dashboard? To create, transparency, to ensure the plan is not just a document that sits on a shelf and collects dust. So does this help towards that? Does this improve your understanding of the strategic plan and the goals presented in the plan? Are the indicators we have chosen meeting the mark? Are they, when you think about progress towards expanding access for families and supporting the workforce, are the things we are putting on here telling that story, or are we missing information to help round out that story? What other data would you have to be helpful? And then do you picture yourself using this? Are you just a consumer of the dashboard, or might you actually use this to help communicate things to your own teams or to community partners? We'd love to know that as well, so we can ensure that the language is helpful for you and that you have any dissemination materials you might need to tell that story. Lindsay, I think that's the end of my slides. I'm happy to answer any questions folks have. I know it was oh, I do have one more slide. Sorry. I think I combined presentations. So there's questions again, the data submission form in the chat. So thank you all so much for the chance to share this. And I look forward to hearing what you all think.
Thank you, Sarah. If anybody has been in Sarah's space, a common statement that Sarah makes is we are a data-rich state, right? We really are. And she says that loud and clear, but I love what they're doing with the dashboard because it really then starts to put that data out there in a way that is palatable and to understand and to really help us assess that we are making progress. And it really takes away the silos. And I just feel really excited that they're launching on our next panel date. January is a very important year in our system because we're going to have the monitoring dashboard, and we are also going to be celebrating CAPE in the first year of launch. So if there are some folks that are on screen that just seem exhausted because of all of the movement that's going on, I think that's a good exhaustion because it means we're you know, very much leaning forward in our early childhood ecosystem. So I'm very excited, and thanks for joining us, Sarah. And we will also have the feedback link added to your notes, so you don't have to remember it and quickly grab it. We will also make sure that that's included in panel minutes. And Lindsay, okay. Last month, I asked you as a group, like, what do we want to learn from our governance summit, and which is traditionally held in February, and it will be the 5th summit. And so we really fine-tune that to not just have it be a one-way conversation with groups sharing information, but really a transactional presentation for not just the panel, but for anybody listening to the summit, and really wanted to focus in on the current early childhood governance structure in our state. So we've reached out to everybody who's represented in the early childhood governance structure, and we've asked them some questions. And we really asked them to start thinking about, how does your work support the Kansas early childhood system? Please share an example of cross collaboration of your work in the EC system. So not just saying, yeah, I do cross collaborate, but what does that actually mean? And I think we really saw today from the MCH world and the work that what that looks like. And what are barriers or gaps that you are experiencing that the panel may help facilitate? Because with the Children's Cabinet serving as the advisory group, and then the panel being a hand of that, it's not just that we exist, but what do we do to support the system? And then really challenged each of the groups. So we sent out the invites and these questions this week because we wanted to give them the space to get really creative of really, based on the work that you are doing today, what would a headline or a secondary headline look like for the work in 10 years? So really challenging them to think futuristic and, where does Kansas sit in 10 years? And I'm sharing this with you because the panel is a part of that EC governance structure. So in January, in addition to our Kansas kindergarten readiness presentation, we're going to be walking through these same questions. And because you are a part of that structure. And what does your work mean? And where do you see the panel in 10 years? So, and we could really, and this is where I'm asking for additional input. So we could take it as a large panel, which I think we should. And then we can also have our work groups put together because they're coming from a targeted lens with our work groups. What their headlines could look like as a representation of the panel. And I really do appreciate this exercise because it forces you to think beyond just tomorrow. And sometimes we really are going from fire to fire and just thinking about today and maybe tomorrow. But I really think that we have an opportunity to set the tone for our vision for what Kansas looks like and our expectations for families and children. So really wanting you to think about this, and that will be work that we will float in January. And just in your work groups today, thinking about if you also wanted to put together a headline for the work that's from your targeted lens. So panel task, and it did go out again all this week to all of the work groups within our the organizations and work groups within our early childhood governance structure. So Lindsay, if we can move to the next one. All right. So we will see you in 2026 on January 16th. And again, our February 20th, really encourage you to put, really make sure if there's a meeting that you really want to be a part of, it's the February 20th, summit. Mark that, check mark that, because that's a really good opportunity to get that very honest feedback of what's going on, how can the panel support different organizations and work groups, and just get that really raw information of what's going on in our state as it pertains to early childhood. Also wanting to remind if anybody wants to listen or has time, but it is also stored on the Children's Cabinet website, is the Children's Cabinet and Trust Fund board meeting, which is February 3rd. I always learn something new when, just as a staff member, joining the Children's Cabinet board meetings, but really appreciate all of the rich data that is shared across the portfolio and depth of the Children's Cabinet work. So even if you don't have the time to listen, really appreciate, there's always a very rich slide deck to both our meetings and to the Children's Cabinet. Okay, and that ends our formal portion of our meeting today. We are going to adjourn, and then we will have our work group breakout rooms open, and I'm going to let everybody take a 10-minute break, and then you guys can join your work groups at 11 o'clock. And have a happy holidays. If you are traveling, be safe and really enjoy, for me, holidays equates to what food's at the table. And so really looking forward to that portion of the next couple of weeks. So see everybody in the new year.